evening, friends. On behalf of diabetic control, I am going to speak few words and giving hint. So there are three important pillars of management of diabetes. First is diet, second is exercise, and third is medicine. So for diet control, you have to restrict your carbohydrate, uh, which includes most of the time our rice intake as well as sweeteners, as well as sweets which contain sugar. Then coming to the exercise, you can go for any mode of exercise like cycling, jogging, running, or any activities in which you can play the game and enjoy it, like tennis, cricket. Then coming to the third most important mode, that is drugs. So drugs has to be taken under the supervision of physician, and it has to be monitored regularly by the patient, which for which he has to do regular visit at doctor and monitor his blood sugar level, as well as other investigation which are associated with the diabetes will be prescribed by the doctor on the regular basis, because diabetes is a disease where if it is uncontrolled by the patient, it can affect any part of your body, starting from eyes, heart, kidney, liver. So you have to be very cautious regarding this disease. So these three important pillars, if they are managed by patient on regular basis, it will be beneficial for the patient for getting prevented from the complication of diabetes.